Is he about ready to get started? People are waiting.
Yeah, he said he should be good to go right now. So if you would like to resume.
Okay,
Thank you.
wonderful. Thank you, Sterling, for fixing that for us. So if we can go back to that community panel slide, just back one slide, Kara, that would be wonderful. So our next community question is going to come from Isaiah. So Isaiah, I give you the floor to do a quick introduction and to introduce your question, please.
Thank you for this opportunity to be a part of this. I'm Isaiah McCorkle. I work for the state of Connecticut as a social worker, DCF. I am a minister at the Mount Pleasant AME Zion Church. I'm very involved in the community. And so I'm grateful and thankful to be a part of this discussion that is very important about how we serve our children the best during this middle of this pandemic. My question that I have is, how is the district equipping its staff and teachers to appropriately and adequately provide emotional safe spaces for students in the educational environment, given the COVID-19 pandemic and the civil unrest that we have witnessed this year?
What wonderful question, Isaiah. Thank you for that. And I'm going to ask that Kelly Trucius come forth and answer that question for us.
Sure. Thank you, Isaiah. So in the district, over the course of our return to school, we were fortunate enough to have a series of professional development days, and a big portion of that time was spent on social emotional learning. So talking about the challenges that this challenging time within our society has presented. Identifying ways that staff can form bonds in a virtual environment with kids and when they return to in-person learning, making sure that we set up our schedules so that there was carved out time every single day for teachers to connect with students on social emotional issues to build community within their classrooms. So that has been a foundation of our work to start the year. We also infused within our academic lessons opportunities for kids to make extensions and connections to community and world. And then lastly, we will continue this support across the year to continue with the social emotional. And there will also be an additional added in training regarding social justice that is upcoming for staff to receive.
Thank you, Kelly, for answering that question so eloquently. So I'd like to ask Jade from Citywide PTO to give us her question now.
Hi, everybody. Thanks for having me tonight. As Ann mentioned, I'm the co-president of Citywide PTO, and I also have 3 children, 2 of which are elementary school students at AIS. Just to be honest, I have a lot of questions, but I will try to keep it to 1 or 2 here. I think my first and main question is, I've been involved in several of these meetings since the summertime, and at the beginning, it was very much based on the numbers. If we were going back 25 cases, rolling average, and now, like a lot of us, I've seen that the current research shows that school spread is not as much of an issue as originally thought. So my main question is, are we going back with a solid date no matter what, or is it still based on the numbers, but the number is different? So my question is within that realm. And then my second question is, do we have direction from the state as part of our decision-making process, or is it all up to us? So those are my 2 main questions.
Thank you, Jade, for those questions. So I'm going to ask Kathy O'Dowd to answer those, please.
Okay. Thank you for your question. In regard to a date for going back, that's something that Dr. Sal will address later in this presentation. But as far as directions from the state, what I can tell you is that we are following Addendum 4, which we're going to discuss a little bit more as we go through the presentation. So yes, you're right. You know, back in the summer, there were some very firm numbers about when you would be full-time learning, less than 10 cases. We were doing at that time a 7-day rolling average per 100,000. So if it was less than 10, you were full-time. If it was 10 to less than 25, that called for a hybrid model. And then the 25 or more called for remote learning. However, due to our building constraints, and the special issues that Danbury had, we were planning to go back in the hybrid model at that point. So again, this has been a pandemic that we have never seen the likes of this before in our lifetime. And there has been no data for us to go back and look at from past experiences. So we've had to just deal with the real-time information at hand. Back in April, May, if you had asked any of us or any of the health experts, what would schools look like 6 months, 8 months into a pandemic, we just didn't know. And this is still a very fluid situation, which continues to change all of the time. So as we learn new information, we move on. So now when we talk about Addendum 4, that gives districts more the ability to make the decisions based on what's happening in their own community. Originally, we were working on just state numbers, and then it was numbers by county. But as a district, we've always looked at Danbury because our numbers have always been much higher than our surrounding districts. So now what the state has said to us is that even though we're in the red zone and we are at a community spread of much more than the 25 per 100,000, they've been able to tell us that the schools that have been open have not seen spread in the schools. And so that's why they are telling us at this point, if you not only look at the community numbers, but we need to look at what our mitigation strategies are, which includes reducing density of the building, our ventilation, social distancing, the mask wearing, all the public health measures to keep us safe, our PPE, our cleaning and disinfection. And these are all items that we're going to cover later on. So that is what's guiding our decision-making at this point. And it will be done at a district level.
And Kathy, if I would just say that I feel like we are very prepared with all those measures that you just mentioned. At least I know I've heard a lot of mitigation strategies that seem very well thought out to this point. So hopefully we will be able to come back in January, considering all the current research.
Yes, I hope
Thank
so
you.
too. Thank you.
Great. That's a wonderful discussion between the two to help everyone understand how those numbers have impacted what we're doing. I am going to ask at this time that if you're not speaking, if you'd please put yourself on mute. We're getting some echoes with other people in the panel, and it's causing them not to be able to understand. So I'm going to move to Christine and ask Christine Fournier to ask her question next.
Christine, before you start, Anne, can you please let me know how many panelists you have left?
How many what?
How many panelists do you have left? I just want to make sure I have the timing down.
Oh,
Maybe
two.
the adjustment. Okay, thank you.
Christine and Doralis.
Thank you.
Yeah.
Hi, I am representative of the elementary level. I head up the PTO at Mill Ridge Primary, but I also have a third grader there, and then I have a fifth grader at King Street, and then I have a freshman at the high school. So I'm kind of all over the place. But I kind of reached out to a lot of my friends that have kids at multiple levels to kind of see, what the running themes are. There's a lot, but the biggest one I think is at the elementary level. The biggest concern is, number one, if people are even going to send their kids to school at this point, because they're nervous, and I understand that. I think I'm making a different decision for all three of my kids. But for the people that are choosing to send their kids to school because they feel as though they need that environment over being at home, is the day still going to look as it was proposed back in October, back in August? It has changed multiple times. A lot of people feel as though that the early day is really kind of shorting our kids when they're going to school. What is the day really going to look like? Have we rethought that? Is it changing from the last time we looked at this?
Thank you, Christine, for that question. So I'm going to direct the answer to Kara Casimiro, please.
Hi. So I know that there isn't any plan to change the length of the day that was proposed for the original first opening in October. Part of the the planning, at the secondary level, so that includes grade 6 through 12. Part of the timing has to do with the fact that we cannot serve lunch in school due to the number of kids. And so in part, some of the decision is based around those release times. What's the longest time we can keep students in school reasonably without feeding them, to be able to send them home, but also in part to this need to plan, particularly in the hybrid environment, which is very difficult. So you're planning lessons, gives the teachers about an extra hour at the end of the day, to not only to meet, but to also develop in what we're calling curricular conversion in their planning. So how do we make lessons accessible in a hybrid or distance learning environment to students who are both at home and in person, and or developing asynchronous lessons to be able to work with students in small groups while other groups are working with independent practice or on another lesson. So all of those things are very complex tasks and require planning if we expect teachers to do them in a high quality fashion. So right now we don't have any intention to change that original time. We did spend a lot of time and effort thinking through those pieces and trying to plan carefully around those. But so those times will stay the same moving forward.
And then as far as, I have a high schooler who, no matter what, I feel that the day works really well for him.
Mhm.
And having the opportunity to meet with the teachers in the afternoon has been a great opportunity. I personally, but I have an honor student who he's just doing well. So if I had a kid that was struggling at the time, I'm sure I would feel differently. But at the elementary level, the Wednesday, Thursday, Friday, the 3 days of limited interaction with the teacher, I think is a big concern for a lot of parents. And just, is it still going to be limited to that short period of SEL time in the afternoons for those kids that are at home versus the kids that are?
So we've had some additional time to continue to plan during this time period, and we've been actively trying to rethink some components. We need to get the kids in first. We need to get up and running. We need to make sure that we're testing all of our systems. We have the students and the teachers have not been back into, particularly at K-5 since March. We have since, during that time period, have redeployed lots of additional devices. Our technology director has recalled some devices from the high school. I'm not sure if you're aware, but we did receive a generous donation of laptops for the high school students. So that allowed us to recall some of the older Chromebooks that were in existence, which are then being updated and cleaned up, and we're able to redeploy some more additional laptops down at the Chromebooks, I should say, down at the K-5 level, so that teachers will now be able to have 2 Chromebooks to work from, 2 laptops to work from, which will provide them with a monitoring device as well as a computer to work from. So we've had a lot of teachers that have asked if we're able to incorporate some more synchronous instruction into our day. Can we do that if we can navigate that? So we have some teachers that are already planning to do that, so that we'll have that morning time will be that SEL and that connection whole group. And then we're going to continue to look for ways to integrate and then make sure that we're circling back at the end. What I can tell you is that the asynchronous lessons, and I'm not sure if you were in the PTO, I did visit the citywide PTO and we had a good conversation about this. The asynchronous lessons will be very high quality. And part of the reason for that, it's not just, it's more than just, we're going to provide students with this lesson so that we can work with students who are in the classroom. But we have a significant portion of our elementary population that are second language learners. And so having that unmasked, visible instruction from a teacher who can hear sounds being pronounced, who can listen unimpeded from the mask, those things are important. Additionally, for the students who are home, we know that a lot of our families struggle with childcare during this time period. Children are either going to grandma's house or they're going off to a daycare. Having those asynchronous lessons that are designed by our coaches and our instructional specialists, pre-recorded, allow a parent and a child to play them flexibly and to listen and sit flexibly at different times during the day. So if a parent comes home from work and they want to engage the child, that's a better time of the day that they can have an opportunity to have those lessons, play them, replay them, and interact. They're also interactive. So children can engage with the slides as well and submit answers. So they are quite high quality. It's an quite a tremendous task to do on our part, but we think it's worth it for our students. But we do expect to incorporate some more live synchronous components during the course of the day. We need to get the kids in first. We need to get the teachers up and running with their laptops, and we need to build in some systems and structures into the school day first to allow some of that, a little bit more of that to happen as we move forward. So I do think you'll see some more of that. That is in our conversations now. We're just eager to get back and get things moving so we can start to work on that.
Great. Thank you, Kara, for your answers and your wonderful questions from Christine. And now we'll go on to Doralis for your question, please. If you'll introduce yourself first and then give us your question.
Hi, my name is Doralis Florentino. I'm actually representing Lead Latinos Advocacy in Danbury. I'm also a parent. I have a student that goes to Rogers Park. I see Christy Zalita is here. So woo woo to Cluster B. Wonderful. You guys are doing a wonderful job. And then I have another son that goes to Park Avenue Elementary School. So some of the questions were already answered by Kara. So thank you. I was noting it down. So I have one question from a parent. I actually translated it in English. So her question is, could there be a way for teachers to be more interactive with students rather than just sending video clips? This way, the students are engaged and interested in their studies. Even though it's distance learning, it is important for teachers to have interactions with their students.
And so I'll direct that question right to Kara. Go ahead.
Sure. Without knowing the full context of what she may be asking, I would surmise that it may have to do with when we are having students do independent practice. And so, one of the things about this environment that has become more visible to parents maybe at home is the idea of small group instruction and maybe understanding that when the teacher is working with students in a small group, that their other students will be engaging in independent practice. And this really isn't any different than when they're in school. There's a large bulk of time at the K-5 level that is chewed up, if you will, with transitions, things like recess, and students often work on independent practice activities that are geared towards their needs, that are personalized, while the teacher takes a small group. But parents don't see that during the day, right? So like if we had an hour in the day for a literacy block, a good portion of that, let's say 50 minutes, you can have students working for 20 minutes in a small group, 5 or 6 students, while another 5 or 6 students are working at a station to complete a task, and another group could be working on an independent practice activity or reading independently. So those independent practice activities happen all day long while teachers work in small groups. And small groups are a really key component to delivering personalized and differentiated instruction at the K-5 level. So it just, we just don't see it during the day, when parents are working, but it happens regularly, and it is appropriate.
Great. Thank you, Kara. And thank you, Doralis, for your question. All wonderful questions from our community panel. And know that your questions will continue as we work through our session here tonight. So if we can go to the next slide, which is around health and wellness. And Kathy O'Dowd started us off really, really well in talking about Addendum 4, the expectations of the State Department of Ed and how they have turned some of that decision-making directly onto the local level. And so I'd like to bring Dr. Fong in at this point to talk a little bit about the environment and asymptomatic students and things that we are doing in the district to keep children healthy and safe. Dr. Fong, if you could just introduce yourself and then answer that question, that would be wonderful.
Sure, my pleasure. Well, first of all, I apologize because I tried to go to Google Meet. Then I'm so happy that Kathy O'Dowd called me and said, no, it's at Zoom. So anyway, in terms of what's happening, I think is probably not mentioned enough in the media as well as some of the consultants. And that is when a person get exposed to the coronavirus, not everyone will become symptomatic. In fact, there's a lot to do with the age of the patient, of the individual. The younger is the individual, the less likely they will have symptoms. So the very young usually are not symptomatic. And by the time they finish high school, even at that time, probably no more than 30% or maybe even a little bit higher that have no symptoms. So it's a significant number without symptoms. However, on the other hand, the fact that they don't have symptoms does not mean they don't carry the coronavirus if they were exposed to that. And so those viruses are just not being able to get into the body of those individuals. So they are like stopping at the door or at the doorstep. So when these individuals cough, sneeze, or talk, they can spread the virus. Therefore, the asymptomatic individual does not mean that they are not potentially infectious. And therefore, it is important to recognize that fact because it will reinforce all of us to wear the mask and not just wearing the mask, but wearing the mask properly. Because by wearing the mask, you not only protect yourself, that is, if somebody cough or talk and so on, and spread the virus in the atmosphere, the mask will protect you. But at the same time, if you are an infectious asymptomatic individual, you're not going to spread the virus. So wearing the mask has two functions: to protect yourself and to protect others. Therefore, it is very important. The number two thing that I want to emphasize, because I've seen individuals, sometimes they, if they go to a restaurant, if they, want to drink something, or if they want to blow their nose, they take off the mask and they just take off the mask and that's it, without understanding that the part in the middle of the mask is where the sort of the problem is, because that's the area when you breathe out, and that's also the area when you breathe in. So when you touch the mask, do not touch the center part. Touch the part that the string or elastic, whatever, that you let it go around your ears, and that part you can touch, but don't touch the middle. If you touch the middle, you may as well wash your hand, and otherwise your hand now become potentially infectious. On that note, I'd like to remind everybody, always carry a pen. The reason is that we know doorknobs and telephones and so on are full of potentially infectious coronavirus particles. So it depends. If you go to a certain place that they require a signature, or you want to borrow someone's pen to write, well, that pen has touched by so many people. So there are things that we should be very careful, and it's more than washing your hands. That even when a simple instrument like the pen, if you don't have one and you want to write something, you're going to borrow it from somebody else, so you touch it. Therefore, it is important. And on that note, it is therefore reminding yourself that it's important to wash your hands often, because we touch doorknobs, elevators, that will push the button, and the door in the sort of institution or the public place, you open the door then close the door. So it is important to wash your hands off often, and also don't touch your face, especially mucous membrane area like the eyes. Don't rub your eyes, don't touch your nose, don't touch your mouth, because you are spreading the virus to yourself. So those are the important points about the asymptomatic carriers. And on that note, it's also part of the reason that even though a lot of sort of information is provided to say the school is relatively safe, which is true, but the word is relative. Not only that, it's a general statement, sort of broad stroke it. Individual schools may be very different. And when we are certainly is at a vulnerable place, because we are a border town, Danbury is just next to New York, and two major highways go through our area, Interstate 84 and 95. And since New York City is a hot spot, and there are lots of potential of spread of infection coming up from New York City, and the importance of that is because we also learned that in the last umpteen years, almost all the decades, for the winter influenza virus, the flu infection, usually goes to New York City first and then come up to Connecticut. And the first town they hit is Danbury and the surrounding suburbs. So it is important to understand that we are at a vulnerable situation. And in addition, there are quite a number of families in Danbury in particular. They may have a very crowded sort of living arrangement. So crowding is also another risk. So it is helpful even in the families. If you are going to have a little get together, make sure you wear masks in the house, even in the house, because most of the time people don't wear the mask in the house. And that's also an important aspect. And then finally, I think it's most important to get your flu vaccination because the peak of the seasonal influenza is in February, and we still have time. And in fact, not much time because it takes about 2 weeks before your immune system is fully functional. So get your flu vaccination. You don't want to have a double jeopardy with both the coronavirus and the influenza virus. That will be a more difficult situation to fight two viral infection at the same time. So those are basically, I make a sort of a quick summary presentation. And if you have any question, I'll be more than happy to answer them at a time when we come back to some of the question period.
Great. Thank you, Dr. Fong, for those very effective strategies that our families can use. Now, the next question I'd like to turn to Kathy O'Dowd for her to talk about what if a child does test positive in a family? What is the protocol that we'd like families to follow in the district?
Kathy, you're on mute again.
Sorry. If a child tests positive, and that goes for any family member, under the current guidelines, they need to self-isolate for 10 days. So if we are currently, in remote learning, but our nurses are following our students, we are getting reports at home of positive parents and positive children. So we are just reinforcing that 10-day quarantine. When we do come back to school, that guideline will remain the same. And as long as they have completed the quarantine, their symptoms have improved, they've been fever-free for 24 hours without the use of Tylenol, Motrin type of products, they will be able to come back to school.
Great. Thank you, Kathy. And we realize this is a lot of information that we're giving tonight. So before our schools do open, our school principals will be sending out all this information to families so they have it at their fingertips. And we'll also, at the end of this presentation, show you where some of this is on our website. So our next,
Can Kathy please address the availability for testing during the vacation period? That question has been presented to me.
Sure. Go ahead.
Kathy, before you interject, Anna, just want to remind you, you have about 11 minutes left.
Right.
Okay. Thank you, Kevin. So over the holidays, when the schools are closed, we still have a link on our website to the city and the availability of COVID testing. There is testing available 7 days a week with the Community Health Center, and that is done over on the west side, WestCon campus off of Lake Avenue Extension from 8:30 to 4, 7 days a week. They are doing COVID testing over there. And at 120 Main Street, the Greater Danbury Community Health Center and Civic, they are testing during the week as well, and their schedule is on the website. I just will add that last week we started the BinaX Now rapid testing through our school-based health centers, and we have referred quite a number of people. The first week, the nurses there did testing on 21 people in the first 4 days. So that has been a very valuable service for us, that through the school nurse, the parent or the child or a staff member will be referred to the school-based health center that is doing testing that day. It is appointments only, but you will get in the same day. Unfortunately, that won't be available over the holidays because the schools are closed, but the 2 community health center sites, along with all of the urgent cares in the area, will be doing testing.
Great, thank you.
Thank you.
Great, thank you, Dr. Sal. So I'd like to turn to Dr. Begg now, and could you please talk to us a little bit about the timeframes of when people should be tested and exposure, after an exposure? Dr. Begg, you're muted.
There you are. Thank you for the opportunity to say a few words. So when you ask that question, it implies that if somebody's exposed now, that if you test them right now, that the test may be negative, and that's correct. So the idea is when somebody's exposed, so say you're exposed on a Sunday, when would they most likely show the symptoms and most likely want to be tested? So the period of infectivity can be, the peak is in the matter of 3 to 4 to 5 days. And so if somebody's initially exposed, while we sometimes test people right away, that test may be initially negative. So the time after exposure would be at least up to 3 or 4 to 5 days. But the problem is we have the period of potential quarantine. So there's different strategies. So one thing is if you have a high risk exposure, you actually may need to be quarantined or for upwards of 7 to 10 days, where if you're tested a few days afterwards, then we are in a better position to consider you being negative. So I will say the guidelines are evolving quite frequently, and they evolve not only based on patient populations, but also the actual availability of tests kind of influences our decision too. Our local Danbury school structure may have a slightly different viewpoint than other places around the state or the country, but the idea is that if you're going to be tested, it's not necessarily timestamp 0 that's going to say that you're negative. You've got to be upwards of at least 3 to 4 days. The biggest area of infectivity, like I said, is a few days afterwards, not at the beginning.
Great. Thank you very much for that answer. And the last health question is going to go to Kara Prunty from our City Health Department. And can you talk a little bit about vaccines and their availability?
Sure, thank you very much. So the state has laid out a plan for vaccinations and the rollout of that, which will be starting in just a couple weeks, maybe even as soon as next week. The first batch of vaccines are going to go to the hospital to vaccinate hospital and healthcare professionals and emergency technicians, EMTs. After that, it's going to go to critical infrastructure employees. So it will be rolled out to police, fire, teachers in that group. After that, it will be going out to the general public, and there is no real estimation on time frame for that. It could be the spring or summertime at this point. They're still doing trials on children under the age of 18, so that's still being investigated.
Great. Thank you, Kara, for that great information. And so now I'm going to turn it over to Kevin, and he is going to work through our distance learning. We may still touch on some health and wellness questions as we go through the other categories. So not always totally done with that category as it is an important one. So Kevin?
Thanks, Dr. Mead. So we have about 10 minutes for this theme. We received several questions from our community regarding distance learning and in-person learning and hybrid in-person. And so just want to ask a couple of questions on behalf of the community. Kara and the principals will ask if you can be ready for some of these responses. We will go through Dr. Casimiro, and then if she needs additional assistance, she will direct you accordingly. So Kara, the first of 4 or 5 questions: would the district consider a summer session to help students catch up? What is the plan to get our students caught up?
Sure. So beginning last summer, we already expanded the use of summer school as a way to help reach more students. So we've kind of widened our normal net, if you will, of students who we normally would invite to summer school. So that was a first good step. And that was actually that was our first attempt at a distance learning summer school, and it was relatively successful. So not sure what that might look like this summer, whether or not we could be in person or we would use a combination of in person and distance. But certainly we've honed some skills in the meantime here. So I think that we'll be able to at least offer some distance learning and or in person summer school to a larger number of students. So long as our resources allow us to do so. In addition to that, in terms of helping students catch up, I know that that's a big concern with parents. Last year, we were also able to position ourselves to and rearrange some staffing to include 13 student support specialists at the elementary level, K-5, and those folks have started this year and have already started working with students. And so we hope to expand and grow out our services in that area in terms of intervention and acceleration. And in some cases, using the term acceleration is more appropriate because we just really need to continue what we're doing and speed it up, double down, and give kids some more opportunities to do some of the practice that they've been engaged in. So, we were happy to be able to include those staff members in our ranks this year, and they will continue next year as well. So we do have a plan in place for that. We'll be working on this for quite a while. It won't be an overnight situation. We'll be continuing to work and to remediate skills for students in the same way that we have been, but just an increase and an expansion of that effort. You're on mute, Kevin.
There we go.
Yep.
And Kara, thank you for that response. And I think the next question you have answered somewhat, but let me ask it anyway. So how will the transition be handled to the next grade level, where there will be a class that reinforces or reviews concepts before they move up?
Mm-hmm. So we have a tremendous curriculum team and supervisors and instructional support specialists that assist with this. So heading into this year, these groups spent a considerable amount of time assessing what needs to be what is critical in this environment. What are the priority standards that need to be taught across all grade levels, and adjusting curriculum and pacing to meet those needs. We will continue to do that across this year as well to make sure that we're attending to the most critical concepts and grade level components that students need to master to move forward. And that work has been ongoing. So, that's just that is, again, part of our normal process that we do each year. It's just this obviously a little bit more intense in this environment as we make adjustments moving forward. But our teams did a lot of work in August and September to get ready for this year. And we meet this year weekly with teachers and department meetings to also to have that dialogue and to do some planning. We normally meet once a month, but we've been meeting every week to do that work.
Okay, thank you, Kara.
Mm-hmm.
So, Kara, this next question from one of our families. In years past, we've had, we don't necessarily have the same data available to us now that we've had in years past
Mm-hmm.
to see how our kids are doing. So, what data? Is there any data that we have available to us to show how our students are doing academically, particularly in the K-5 areas?
Sure. So we have administered the STAR assessment this year. So we have a STAR assessment in numeracy and literacy. However, and normally we use that as a universal screener across the school year as a sort of just a little dipstick to see where students are in real time and to be able to measure cohorts across grade levels and across the years. And some assessments, as you know, are better for larger benchmark, sort of broad stroke visioning of how we're doing as a district or how we're doing year to year. And other assessments are much better for more instructional information. And so we did administer the STAR assessment. I will tell you that we've deemed it to be a little unreliable in this particular environment because many students are taking it at home under different circumstances and conditions. And some of our younger grade levels, we've had very good data come back, much better than our normal trend, which is probably in part that kids are home and they may or may not be getting a little bit of assistance with helping to log in. And it's not it's hard to assess whether or not, the reliability of that in each household and who may have had a little bit of help with the assessment or who struggled completely with technology, and that's the reason maybe for a score that might not be reflective of ability. So we did administer the assessment, but we're taking that with a grain of salt for now. We do have reporting responsibilities with the state because we're a priority district, so we do report that information. In some grade levels, that the students did better, in some they did the same, and in some they did not as good as they normally do. So it is one indicator, one point in time. But more importantly, in this environment, what we have been stressing is more of a micro informal assessment on a daily basis and on the weekly basis. We put a lot of effort into making sure that teachers are providing really good learning targets for students. Those learning targets are based on standards, okay? And in this environment, those are based on priority standards. We've done a lot of that work for the teachers to make sure that everyone is prioritizing the same. But they're adjusting based on student need. And so, teachers are really the best judge of how students are meeting those standards and how they're responding in this environment with the work that they're being provided, over time. So while we don't have those larger assessments this year, we are relying more on informal, smaller assessments across the year. One of the things, I think people are really interested in, I think you get a better sense of what's happening at the secondary level in terms of assessment. Things look very similar to maybe the way that they did prior to this, right? A lot of students were using online programs and technology. They were writing essays and answering questions using digital platforms. But maybe, our younger learners, it's a little bit more of a question mark. How are they responding in real time to this? So I do have Keisha Smith. She's one of our wonderful elementary principals, and she's also our K-5 elementary principal lead. And so I've asked her to speak a little bit about maybe her insights on K-5 in particular, since I know that that's a concern of parents.
Thank you, Kara. Good evening, everyone. I must say our children, the elementary level, have really adapted to this environment, although this is very new to a lot of our children. Most of the morning and day, I must say they are amazing. Our children are amazing. We can't stop, saying what a great job they're doing, not being in front of their teacher every day. As much as we miss serving, our children, they have done I can't say enough, a wonderful job of adapting in this unprecedented time. When we're joining administrators, my team members and I are observing the classes, we notice that students are engaged and they're doing the best that they can. The teachers are providing students with one-on-one, if needed, small group, and doing everything possible to make sure that our students get what they need, again, with the time that we have and able to do it with them. So we are pleased with that. The teachers are, working very hard and assessing the children every day and every week to see how they're moving. What we're doing now totally looks different than what we had done in the spring. In the spring, we were just thrown right into it. Everyone just had to pick up and run and work with it. But with the help of the coaches and many of our instructional leaders, the information, the data, the stuff that our children are getting allows the teachers an opportunity to plan and really work on what the children actually need. We look forward to getting back to school, of course, whenever we can. And again, we miss our children, and we can't stop again praising them for all that they're doing. And we do thank our parents and community members for really helping make this possible, because none of us could do this without you. Thank you.
Thank you, Principal Smith.
Kevin, I might add to that that our attendance in this environment for instruction has been very good. I don't know if Kara Wanzer might want to speak briefly about that.
And then we have time to answer this question and we'll move on to our next category.
Okay, great. So the attendance rate has been tracked very closely from year to date during distance learning, but also in comparison to what the previous years were. We're right on target, about 94%, which is very typical daily attendance across the district. In fact, the amount of reporting that we had to do for the state has increased from the previous year to be sure that we don't have disconnected students who are not attending and nobody kind of knows where they are. So the buildings have kept meticulous records on all students, have counselors following up, administrators, teachers, and so our rates are in line with where we see them this time of year.
Great. Thank you, Kara, and thank you, Kevin, for those. At this point, we're going to move on to more general questions. And I'd like to start the first one, address it to Kevin Walston about who are the drivers in making this decision about going back to school?
Yeah, thank you, Ann, for that question. And so Ann, one, because I recall the question, I know part of that question was, are the teachers or is the teacher union behind the decision-making process? And I just want to say, we certainly, the teachers are certainly, they help drive the decision-making process because it's their health and welfare that certainly we're mindful of as we make this decision. But it's not just the teachers, it's all of our staff. It's our administrators, our bus drivers, our custodial staff, it's everyone. But ultimately the decision sits with the superintendent. And I know Dr. Sal is on the call with us, but ultimately the decision sits with the superintendent. And as we mentioned numerous times, he also meets with the cabinet, but also meets with the medical advisors and gets their feedback to help inform his decisions. But ultimately, that decision sits with the superintendent.
Great. Thank you, Kevin. Our next question I'm going to address to Kara Prunty in our local health department. And we received many questions about how, as families, we can be proactive. And I know Kathy O'Dowd has answered those. But we'd like to hear from you a little bit about how the city is being proactive on any blatant disregard for the guidelines of social distancing, wearing masks, and such. Kara?
Thank you. That's a great question. So we have a couple of ways that we are addressing this. We actually have a task force that we made this past week that's comprised of several different city departments that is doing COVID compliance enforcement. We have inspectors that regularly are going out checking for COVID compliance. We also have a way to report any businesses or any situations that might need our attention on our website, where we can take those complaints and we follow up on every single one of those complaints. So we are trying to be proactive in enforcing the sector guidelines, in addition to putting out information, trying to educate everyone and get the word out as much as possible about what's going on in the community, the heightened level going on, and getting the information out so that way people can follow guidance.
Great. Thank you for that. And thank you for the city being proactive and helping to keep all of our citizens safe. And so our last question in this category is going to go to Kevin. And how are we making schools a welcoming environment to our families? And can you talk a little bit about some of our newer policies? And then how do we still make provisions for families who might need to drop something off at school and things like that to make sure their children have everything they need when they're in school during the day?
Thank you for the question, Ann, and it's a good question. And so one of the policies that have been recently adopted that has been very important to helping to keep everyone safe in our schools, our staff, and our children is the no visitation policy. And frankly, there's nothing welcoming about that policy at all. However, it is helping to ensure the safety of our schools and our community. But I can tell you, Ann, and I'll share this with everyone, I think our principals have found that they've been able to engage with our families in ways that they have not been able to reach the numbers that they have in prior years. I think this is certainly a silver lining in this last year and a half, year plus. It seems like 20 years, but in this last year, we have found ways to connect with families like we have not done before. I think we've been very successful in that effort. As you know, we've always looking for ways to increase our communications with families. I know the principals have also sent out correspondences to our families when we thought we were reopening in October. and walk the families through what the process would be if they had to drop food off, if they forgot something and they needed to bring in medication. There was a process in which all of those things could be done at the front door through to the building secretary. So I know the schools had made modifications, based on the in-person reopening plan. But certainly, being welcoming in this environment is challenging. But I can tell you, I know the principals have also had open house. I know the principals have had community meetings with their families. And so they have found ways, very innovative and creative ways, to continue to engage their families. And I'm continuing to hear that the participation has been as great as it's ever been. And I'm not trying to sugarcoat this thing, but these are real stories coming back from our school leaders that we're hearing and learning as true outcomes of this process.
Kevin, if I might, this is Dr. Pasquarello. I've read the numerous activities of the outreach of our teachers and administrators going to homes and making connection for food, making connections for connectivity, just making sure that our folks are safe and have access to essential things they need for just conducting the online learning and for just body needs for health and development, such as food and nourishment. But along those lines as well, the board was very proactive in setting an actual policy. You heard Dr. Beggs and you heard Dr. Fong, the essence of social distancing and the importance of masks. The board stepped up and developed a specific policy that endorses the wearing of masks and the importance of that. So that is a new board policy that they put forth that we have been enforcing, because we've had our preschool in, we've had some special students in, and part of this is education, making sure that youngsters are wearing it. And I am, for my colleagues in the area that have been in, the adaptability of our youngsters to wear masks has been tremendous. And the board has backed it up with a policy which I very much appreciate, for not only for students, but for adults. So I just want to be sure to mention that. Thank you.
Great. Thank you. All good questions and great answers. And so at this point, I'm going to turn it back over to Kevin, who's going to talk a little bit about our finance and answer some questions about the CARES money we received. And then we'll move right into mitigation strategies and the reopening, because I know that's what our families really want to hear about. So Kevin, if you'll take it away with finance and the CARES funding with Courtney Laborious.
Thank you, Anne. Thank you. And so, Courtney, you ready for all of the big money questions?
Oh, absolutely. Okay, thank you, Kevin.
So Courtney, I have a few questions for you. And I know these have been some ongoing questions from the community, given our buildings have not been open. But one, what were the CARES funds to be spent on? Can you just kind of review that?
Sure. Thank you, Kevin, for a good question, and good evening, everyone. Yeah, so the CARES funds, when we say what it's spent on, I'm going to talk about what it's proposed to be spent on. So some of it has already been spent and some of it is to be spent, because throughout the year we're providing these strategies. We didn't just receive CARES money, we also were fortunate to receive coronavirus relief funds from the state as well. And the CARES is one part. And then we also received some additional assistance from the city, reappropriating some funds. So all of the things that are related to coronavirus and the pandemic are sort of one-time phenomena. So it's not something that is part of our sort of base typical operations budget. So I'm just going to tell you that we received have spent or are to spend about $7 million in total, of which about 5.5 of it is being spent this year. And we've been very fortunate in the partnership with the city and the support from the state. The 5.5 million in this year, I'm going to tell you broadly, the really amazing work that Dr. Casimira just spoke about with the curriculum, she's been able to do because of this, leveraging the good work that they've been doing, but in addition, to fit this blended model, it required a good investment in modifying some of the curriculum, as well as purchasing some software that enabled us to leverage things across the district. So that included training materials, staff curriculum development, software that's tailored specifically to English learners, more investment in Google Classroom, leveled K through 5 ebooks, online courseware for 6 through 12, as well as software for literacy and numeracy, independent practice through K through 12, things that we'll be able to continue to leverage in our district even beyond the pandemic. So it's been really exciting for that regard. In addition, we'll be talking a little bit more about mitigation strategies, but we purchased through the excellent work of our facilities director, Richard Jalbert. He was able to do some desk accommodations, purchase and install signage throughout all of our buildings. I'm excited for people to see when they come back in that really reinforces our strategy of mask wearing, hand washing, and social distancing. And it's colorful and it's bright and it's happy to see the schools, even though you know it's not. We don't love to have to distance from each other, but it does help to reinforce that message. We also bought HEPA filters for rooms that needed additional ventilation support, such as the isolation rooms that Kathy O'Dowd spoke about. We upgraded some of the isolation rooms with windows so that we could have viewing into the rooms. We purchased professional development software for social emotional learning. So the great work that Kelly spoke about so eloquently was reinforced with some professional development tools that we could utilize to support that enhanced curriculum and be consistent across the district. We also bought bulk sanitizer, disinfectant, and we are purchasing, we've started the model in anticipation of our opening, additional custodial staff to support that rigorous cleaning that we have in place. We also, through Kathy O'Dowd, purchased a significant amount of PPE, and she really ensured that we have all the appropriate items in place for our you know, kids that have special needs, working with special pupil services director Kelly Trichsis for face coverings, face shields, disposable gowns were appropriate, and gloves for people working with children with high specialized needs. And then Kathy O'Dowd really made sure that we have in stock the PPE to support anybody that shows up at the school on any given day that might have soiled or inappropriate gear, that we have that for them, as well as on the buses when students arrive, if they are choosing to ride the bus. Finally, the state also donated Chromebooks, through a state grant. Our director of technology, Gina Jasmine, purchased Chromebooks to distribute throughout the district for one-to-one. And also, she worked with the state to ensure that we have internet connectivity through vouchers for all eligible families. And she even went out and got some hotspots for those that had challenges getting that internet connectivity. So I would say, in closure, all of those funds have helped us shore us up for this, you know, one time related to the pandemic and being school ready. In addition, some of it will be able to sustain us beyond the pandemic.
Courtney, can you,
Courtney,
Kevin, can I
have,
ask her a question?
Yep.
Can you
yes,
just
we
speak?
still have 2 more questions here.
Okay, I just need to have her. Would you just briefly mention the audit that took place? I think that defined the purchases as well with the engineers.
The audit that took place. I'm sorry, with the architects?
Yes, I think it's important so people know
Oh, yes,
you
Dr. Sell.
targeted.
So it feels like ages ago, but it was so important to. So we partnered with an architect firm that the district has worked with in the past, and they did an audit of each of our type of schools, so an elementary, a middle, and a high school, and they looked at every aspect of our school to ensure that we were optimally distancing within the state guidelines and the American Institute of Architecture guidelines for school settings. So they actually mapped out for us where all the desks should be situated for maximal social distancing within the classrooms, how we should place that signage that we purchased within the hallways, as well as, you know, how to space out children where they're eating in the cafeteria in the elementary schools. All of those were really incredibly thought out in great detail, and then rolled out to all the other schools in the district and modified for their specific needs at given schools.
So,
Thank you.
Courtney, I have 2 more questions. If you can answer these in like 1 minute each, that would be great.
Yeah, I'll be quick. Yep.
Okay, the next one is, were desk shields ordered for our students? And if you can provide some updates and some clarification on how we're handling that would be awesome.
Yes, thank you, Kevin. So I know there's a lot of talk about desk shields. We did order desk shields for all students in K through 5, and for any students who require close proximity to receive face-to-face instruction. As well, there's shields and distancing guidelines for that in place as well. All support staff that work directly with students with disabilities are also provided with desk and face shields through the work of Kelly Churches. And we received some additional funding from the state. So we're also in the process right now of rolling out additional desk shields to the middle and high schools, you know, where, for example, at science tables, students are sitting at the same table. They're appropriately distanced, they're at the same table. So we've got these additional shields for those purposes.
So Courtney, I know at a later meeting you may talk about these things with the full board, but since school is not in session, no buses running, maybe a reduction in food staff, maybe a reduction in advocates, et cetera. What is the district doing with the money they saved?
Yeah, so it's a great question, and we've had this question. We really are not saving money this year. We don't anticipate it. Now we're not not all the way through the year yet. We're not even halfway through the year. But a bulk of our costs are personnel, so our staffing and our benefits, it's a majority of 80 to 85% of our budget is that. And we're still serving the same number of children. So we still have the same number of teachers employed and the same number of staff. As a matter of fact, it's gotten a little bit harder rather than easier. But so we still have, and per the governor's executive order 7, we're still employing all of our safety advocates, our secretaries, our nursing staff, and our food staff, cafeteria staff to ensure food security for our families. So in lockstep with our sister schools and other districts, we're still running our full set of services. There were some minor savings last year associated with fuel for buses, for example, because we weren't running our buses, and running of our buildings because our buildings were really fully shut down. The city gave us that money back. That's part of what we were able to leverage that $7 million this year to invest in all the things that we needed to do to get the building safe. So we don't really anticipate any savings this year. So yeah, to answer the
Okay.
question.
Okay.
Thank you.
Thank you, Courtney. Thank you so much. Kara, we're ready for the next slide.
Great. So thank you for those answers. So we are going to jump right into the mitigation strategies. And the mitigation strategies are strategies that we'll be using in our schools. They're written in the reopening plan that will show you where it is in just a few minutes. And really are the strategies that we have developed based on the research, based on our experts, as Courtney just talked about, having the architects in the school to help keep our students safe. And so Courtney already spoke to the one about the student desks and having barriers. But could you elaborate a little bit more, you and Kathy, about what other mitigation strategies are we using to keep our students safe?
Sure. Yeah, so we're also, we looked at reducing density, so there's fewer students in each classroom, particularly in the hybrid model, and we're allowing guardians to choose full distance learning. We're still running the same overall number of buses, so it reduces overall ridership on individual buses. And students will have their own materials. There's no sharing of materials. Water fountains are closed and we have bubbler stations. This is all in compliance with recommendations from the state and from the CDC. We have physical distancing, so there's at least 3 to 6 feet distance between all the desks. Signage encouraging the distancing and directional flow to maintain appropriate transitioning in the hallways. We have grab and go meals for the secondary schools and cohorting and distancing for the cafeteria where there will be in cafeteria eating, such as in the elementary schools, and encouraging eating in the classroom where practical and we're able to do that. Kathy, do you want to talk to the medical portions, mask wearing, et cetera?
Sure. Thank you, Courtney.
Thank you, Kathy.
So yes, we have a mask policy in place. So all staff and students are required to wear face masks. As Courtney had mentioned before, we do have a backup supply. I have given a supply to the bus drivers. So when we return, if a student is at the bus stop, they don't have a mask, they will be provided with one. All of the nurses have a backup supply for staff and for students as well, should they need a mask replacement during the day. We also, we purchased and also received a very generous donation of cloth face masks that we are providing for staff who would like them, and we also have them for our students. In regard to the masks, some of our high needs special ed students may have some trouble with mask compliance, but that is an exception that can be made. However, the teachers right now with our self-contained kids that are in, they've done a wonderful job in being very creative with strategies and helping the children to adjust to wearing those masks. We also have face shields for the children and for the staff as well, if they are needed. Every classroom has been provided with cleaning supplies, hand sanitizer. We have different hand sanitizers throughout different stations throughout our buildings. And, as I said, for the special needs kids that we've had in for the last 2 weeks, it's gone very well.
Great. Thank you, Kathy. And this question is for Courtney. Can you tell us a little bit about the disinfectant we're using, and is it effective? How do we know it's effective to cleaning the surfaces in our buildings?
Oh, thank you, Anne. That's another good question. So we're in compliance and following the guidance as Kathy keeps mentioning and has shepherded us and led us so wonderfully of the CDC and the state guidance for what are appropriate sanitizing materials, when we use them, and what are appropriate disinfecting materials, and when do we use those. So, the state modified slightly their green requirements for the sanitizing solution, but it's still a safe material for children that are asthmatic and for use indoors. We've provided that throughout the schools and in individual classrooms, as well as training for all of our custodial staff on the appropriate usage of the recommended disinfectant and sanitizing materials, as well as the bus company, because they have a protocol as well. And so we will refresh that training before we go back to school in January for our custodial and bus staff, but they receive that as part of the professional development at the start of the year.
Great. Thank you, Courtney. And our last question in this segment is going to go to Kathy O'Dowd. What are the things that we'd like families to know that they should be doing before they put their child on a bus or they bring their children to school? And if a child does become sick during the day, what is our expectation of parents at that point when they get that phone call?
Okay, thank you, Anne. So on our health services website, and also we have provided these documents through a number of Dr. Sal's newsletters, and they have also been sent out from our school nurses. We have our sick day guidelines, which we are going to ask parents to please go by those sick day guidelines. Do not send your child to school if they are sick. We're no longer in a position, just from a safety perspective, that we can have children who might be mildly ill in school, and we can do some interventions and hope that they can tough it out and make it through the day. That's just not possible anymore. So we are asking you to please keep your children home if they're sick. Don't send them to school to give them some Tylenol or Motrin to think, well, maybe they'll feel a little better and it'll be okay for them to come to school. It's so very important that children do stay home when they're sick. So our sick day guidelines will be put out again for parents for their review. And you'll also be provided with, and we have on our website on the health services webpage, the self-monitoring form that we are going to ask all parents. We have one for staff as well. The list of questions that you should be asking and observing of your child for any signs of illness, signs of fever. For families who don't have a thermometer, we had a donation, and we certainly have extra thermometers available. Please contact your school nurse and they'll be happy to provide you with one. And we will ask you every morning to please observe your children for any signs and symptoms of illness, and again, refrain from sending them to school. Now, should your child become sick during the school day, they will be referred to the school nurse. They will be assessed. We have very specific criteria for assessing the child to determine whether or not they need to go to the isolation room. And we ask that you please keep all of your contact information up to date, current phone numbers. It's very important that we be able to reach you should you need to come pick up your child. And it is our expectation that you be able to pick up a sick child within 30 minutes. And you will be getting that call from the school nurse to do so.
Great, thank you, Kathy. I realize there's many more questions that our families had, and so we will be putting those into a FAQ that will go up onto the website that will help families process some of these other questions that they had. I do believe at this point, though, we have touched on all of the ones that we had numerous variations of those questions, of that particular question. And so hopefully we've met your needs so far. So I'd like to turn it over to this point, so to Kevin, so you can actually see what our schools look like. And I'll preface this by saying this video was made in October when we were originally going to think about going back to school then. And so you won't see the desks, devices on the desks because they weren't there at that point. They are now, though. So Kevin, if you can start the video, that would be great.
Yeah. So Dr. Mead, we have one more question I want to make sure we touch on before we move on with the presentation. I also want to share for the community the video itself. I'm not going to share the video in its entirety. I know the community wants to hear and learn how we're going to reopen and when that's going to happen. So we want to make sure we provide that update. But I wanted to make sure we address this question that I know was resonating in our community. Dr. Casimir, I'm going to pose this question for you. And I know your principals may also want to be part of the response. But the question is, how are the equity issues and disparities across racial and economic lines for student engagement being resolved?
Thank you, Kevin. So we have been very focused on all of our students and making sure that everyone is connected in this environment. And it really comprises a good part of a school leader's day to follow up and follow through on students who may or may not be connecting. And I'm happy to report that, given the size of our district and the great span of students that we have, that we do not have a significant population, although we still do have some. Our principals have been morning, noon, and night meeting kids and their leadership teams to distribute laptops, to go to the ends of the earth to make sure that kids have what they need. There isn't any time of the day you can't see a student and or a parent making their way to make it an appointment or exchange for a broken laptop or to pick something up that might be helpful to them in terms of technology. But I'd like for them to speak a little bit about maybe some of what they're seeing there and how their schools are responding. And I'd like to start with Dan Donovan, who's on the call tonight, as the principal of Danbury High School. Dan, if you could just talk to a little bit about the efforts of how you handle students who have been disconnected in this environment.
It's a tiered process. It starts with the front lines of the teachers trying to make contact via email, phone calls with the home and parents. From there, it's kicked up to the school counselors who take the information and the efforts made by them and try some of similar things. They have a couple of more phone numbers they may be able to get to and things but eventually it gets to our administration team. And from there, it's nothing more than just boots on the ground. We go out every week looking, we take the folders with us and we're traveling all over Danbury, knocking on doors and trying to engage kids that way. We're having technology issues with the Dells that come in on resetting passwords. So a lot of times the students will come up to us and we can reset them right there, or we go to their house. And there's nothing beats us going out and sitting down on the porch outside, socially distanced with parents and saying, hey, here's what's going on. They're not connecting to school. What can we do to support you? What technologies do you need? And then from there, I believe the district's done a very good job, whether it's, we can get them on the food distribution list, we can get them, hotspots and things like that. And we have the computers, we take them with us when we go. And if a student doesn't have technology, here's your new computer. You mentioned earlier the grant from the Dalio Foundation that gave everyone a laptop, and we still haven't handed out all the laptops yet. Some are still sitting there. So we're in a constant thing. We found that we had about I think our last check was about 86 kids that we were really struggling to try to connect with and find. And we're also finding that some of them are taking this opportunity. They still live in Danbury, but they're taking this opportunity to go spend some time maybe with another parent in maybe in a different state. This distance learning has allowed them to do that. So they're going to other states and staying there for an extended period of time while still working. So we're all over the place on them.
Thank you, Dan. And if I could just squeeze Christy in for just a second, the amount of work that folks have been doing has been incredible. And it's hard to see in this environment, but it is real and ongoing. Thank you, Dan.
Yeah, echo what Dan has said. We're doing the same kind of path. I would reiterate, I just looked up our log entries. Our teachers have logged over 5,000 log entries. That's when they email a parent, when they call a parent, when they talking point a parent. That's just this, and that's just in the distance learning log entry piece. It's like you said, it's 24/7. It's logging in. Kara Wanzer mentioned it before. We're looking at attendance. We've always looked at attendance. Very important. We're always on point, but I don't know that we've ever looked at it this closely with this specific kid. And did you talk to him? And who has made contact? And if you didn't make contact, then we're knocking on the door. My favorite new app is the Google Translate on the new iPhone. I can speak anything now. And just being able to connect with parents. I think you said it before. The piece about connecting with parents, YouTube channels, I have one of those, and many other administrators are utilizing this platform to kind of put it out there. I think that trying to make that engagement piece with kids, and we're not having that huge disconnect when you look on the news and there's all these millions of kids. That's not what's happening here. And I think it's because we've been spending since March figuring out what's working. And if it's not working, we figure something else better. We're not just, stuck in one place doing the same thing over and over, thinking it's going to change. We keep evolving and keep changing into something that's working better. And our school counselors, our social workers, they're working their tails off too. They're connecting our parents with outside community services that are helping them, make changes in their homes so that they're not disconnected. The voucher system that we've been able to hand out to parents. Anytime we do it, boom, we put it in the spreadsheet, we get a voucher, we talk to parents. Parents are emailing all the time, thank you, thank you, thank you. So I think that working with the community as well and getting parents what they need has been a key to keeping that number of disconnected really low. Thank you.
Kevin, I think we found some interesting facts today about outreach. We did an audit of our messaging system. And as you know, we're not even halfway through the year. We had to date about 1.5 million phone calls going out and 1.6 million emails going out. And that's formally. So the outreach behind the scenes has just been incredibly powerful. We could always do better. But I think, as Dan pointed out, I tried to mention before, the number of folks that are going out and reaching out to families, in many ways, it's warmed my heart because there's such a caring atmosphere and a nurturing atmosphere, even in this atmosphere where we're not face to face. So, I think the community and parents should know that we are making that our teachers and our administrators, we're making that effort. Very impressive. That information we just found out today. Thank you.
Thank you, Dr. Sal. Dr. Casimiro, thank you. Dr. Zalita, Mr. Donovan, thank you. And Principal Smith, I know you didn't get a chance to talk, and I know a number of our principals are not with us this evening. They didn't get a chance to speak, but I know all of them have been part of this effort, getting out into their school, getting out into their school community to connect, to make sure that their kids are connected. So I just want to say kudos to all of our school leaders, and then of course the staff who also been part of that effort. Kara P, can you?
I'm sorry, can I just say thank you to our parents? We've had parents that supported us too in this effort at each level. So, even though it's a lot of our team members and our principals that are doing it and school team, their community members that are stepping in and parents helping everybody. So we thank you as well.
Kara P, we're ready for the video. And so while we're viewing you're not hearing the audio right now, but I just want to share with everyone, we will have the PowerPoint available online for the community. And so actually when you hear it online, you'll actually hear music in the background. But what you are seeing is how our classrooms are positioned, how our hallways have been reconfigured with the architect's recommendations. These are the things Courtney Laborious was speaking to earlier. And so you'll see that our classrooms have been prepped for the return, that we have stations for sanitizing stations as per the plan. In some of our schools, we have one-way staircases or staircases where kids are supposed to be on one side of the hallway. All of our water fountains are shut down, and in most of our schools, in most places, we've been able to install water fillers. There's a 6-foot boundary at the beginning of the classroom barrier for all the teachers, and then all of our students are at the minimum 3 to 6 feet in every classroom. So this is what you're getting an overview of right now. Thank you, Kara.
Wonderful. Kevin, if you can just bring up
So,
the slide.
Kara, if you can go to the next slide. You just closed. Yep. Thank you. And so if I just want to share with the community, if you want to get a hold of our reopening plan, you can go to the district website. Again, this will be available on the website, so you can press this link. But Kara, if you can go to the next one. Okay, and when you go to the district website, there'll be important links, and under important links, there's actually a space. There's a space that says reopening plan, and you can select in English or in Spanish, and it will bring you to our district plan. You can go to the next one, Kara. Next slide. Okay. And I know many of us have been waiting for Dr. Sal. I think we position ourselves just on time with the 20 minutes. Dr. Sal is going to speak to the community about our reopening efforts when we're planning to return. Dr. Sal, I just want to thank you again for your patience and leadership in this effort with the team.
Thank you, everyone. Before I talk specifically, many of the questions that I've been getting, and I've gotten many emails these past months that you can imagine, and I've tried to respond to all of them. Some I may have missed, and I apologize for that. It is important for us to communicate with our parents. We do care, and I know you care as well. We may come from a different perspective, but our goal is the same, to make sure we have a safe environment for our youngsters and we provide them a quality education. But I must say that before I talk a little bit about the opening, the questions that I've been getting, and I think parents would hear about, is our procedure for identification of a student that's infected in terms of contact tracing, the opening and closing of the school. And we didn't hear much of that at all. And I would like for Kathy and for Kara Prunty, starting with Kathy, talk about the identification and the contact tracing and where parents can be updated about what we're seeing in the school, because I do believe that transparency is very important. There are protection in laws in terms of who has the virus, doesn't, and who has the infection, but there are very, very specific protocols. And I think it's very important for our parents to hear that, particularly as I talk about our plans to return with a targeted date in January. So Kathy, can you begin that for parents? And then Kara Prunty, you could kind of chime in terms of a tremendous cooperation between the city and the town, contact tracing and how we report them, and how parents could be expected, how in terms of what we actually, what's happening in the district. Kathy, can you start, please?
Sure. Thank you, Dr. Sal. So if we are notified of a positive case, or if we have an ill child in school that is sent home who eventually turns out to be positive, that's when the school nurses and I will begin our contact tracing. So what needs to happen at that point is we need to look back and we look at the last day that the child was in school, and we go back 48 hours. And this would apply to a staff member as well, to consider that a period that they could have been contagious. And so then we need to identify who came in close contact with that student or staff member. And we identify close contact, meaning that someone spends 15 minutes or more, and it's not one block of 15 minutes, it can be cumulative throughout the day, in less than 6 feet of distance. And that does include with wearing a mask. Whether you wear a mask or not, it's still identified as close contact. We will be wearing our masks in school. So at that point, we need to identify all close contacts. And once that has been done, we will start the quarantine process. So anyone who is identified as a close contact needs to quarantine for 14 days. That is the current guidelines that we are using. I know some people have had questions about the new CDC recommendations that came out, but the state is still looking at those to see if we will be adopting them. So for right now, we still are following that 14 days, and we request that either the staff member or students be tested for COVID. We certainly will refer them to places where that can happen. If it's a child who becomes sick during the school day or a staff member at our high school and middle schools with school-based health centers, will be able to do the Binex rapid testing for symptomatic people. So once those contacts again have been identified, a letter will go out informing people, parents, that their child has been identified as a direct contact. We don't identify if it's a staff member or student. Again, as Dr. Sal mentioned, there are privacy issues. So we will just say an individual or a person in that particular school community has been identified, and parents will be notified by a robocall and a letter. And then there's a general letter that will go out to the school community. And in terms of keeping numbers, I'm in the process of working with Gina Jasmine on a dashboard where parents will be able to just click on a link on our webpage that will give them information as to how many positive cases we have in any given school on a given day. So that would be our process for referring, would be through those direct contact letters going out by email and robocall.
Kara Prunty, do you have anything to add to that?
Yes, and then they'll follow with the city's contact tracing. Kara can talk about that.
Yeah, thank you. So we will get notified and our contact tracers will reach out and contact the family. We mainly speak with parents if the individual is under the age of 18. So for students, we'll talk to the parents and we'll conduct our regular contact tracing as we do for everyone else within the city. I will say that also there is a state reporting thing where you can see where all the number of cases throughout the state in every school. So not just Danbury, but there is that data statewide.
Okay, so thank you very much for doing that. That question has come up many times in terms of how we would approach it and who's notified and what kind of reports we have. So, you know, as I listen tonight, I think there's no question.
Sal, can I just put in a little, I think it'd be helpful for people to know that the contact tracing, because I heard from friends and relatives and friends that basically says, well, how come it takes so long to do the test? You know, a few days, 2-3 days before you have the answer and you don't do it right away. Well, the reason for that actually, you know, you don't see it in the media. Basically, there's a rapid test, which means just, you know, do a sort of an immunofluorescence type of, you can get it in a number of hours, an hour or two. But usually that is not necessarily sort of reliable because it's basically like a screening test. But then when it comes to the real test that takes 2-3 days, the name of the test is called qPCR. The Q stands for quantitative polymerase chain reaction. The polymerase chain reaction is basically putting the swab, whatever's on it, the viral particles, and multiplied it with chemicals that basically allow the RNA virus to be duplicated so that instead of having just one viral molecule, you may have hundreds, thousands, or tens of thousands, or millions of them. So they can actually quantify. And that's why it takes a few days to get the result. And for that, many people will say, well, for contact tracing, it'd be nice to have the result right away. Then you can, trace the spread. But unfortunately, the test itself takes multiple steps, and that's why. So it's called quantitative PCR, and it's basically takes 2 days before you can have the result.
Yeah, Dr. Bill Begg, if I may.
Yeah, go ahead.
So just a point of clarification to dovetail what my colleagues just said. I was asked earlier, when you should optimally test someone if they're exposed. Well, if you think about it, if you're that worried to test your child, you shouldn't be sending your child to school in the interim period. And you should consider what our school guidelines are for quarantining children and the like. Again, just because you're going to go get a test and the results aren't back, if you're that worried, in my viewpoint, you shouldn't be sending your child to school.
Thank you, Dr. Banks. Let me just start by saying that I appreciate the work that's being done. It's just a wonderful opportunity for, I think, the community to hear about and learn about really the work that's going on behind the scenes. It has been a yeoman effort by everyone. Yeah, what happened to us in October, we were ready to go back, and we had a last minute change. I regret that. I do say that, but what's in my lens is the safety of youngsters, and following the information at that time, I made the decision that I had to make. So, where we are now, we have learned quite a bit, and what we told parents back then, and I've told the board, we need to learn and stay with the science about what is going on, and the advice at the time has evolved over time. As you kind of pick up, you've picked that up tonight. The research based from this fall is actual data from the state of Connecticut. That's why you're hearing from the governor, endorsing, being in school is important. We know that, the social emotional needs and many other factors. But the decision is relegated to individual towns. There is not a top down. There are recommendations to follow. And I've been very mindful of following that. So, what is different now? I think what we've come to learn that the numbers are the numbers, and the focus on that may be taking the eye off the prize, that we really should focus on the strategy of mitigation. So, what we keep being asked is, what's going to be different? The numbers are so high. That's true. That is very true, and that may not change. We do know that the social distancing is challenged during holidays. We can't mandate people not visiting. We can recommend, but that's going to happen. And the surge you're seeing right now is an affirmation of those gatherings from these past holidays, and we tend to see it again. So I think it's behoove on our part to make sure that we're attentive to that, and we make the necessary adjustments. So we have met with the gentleman that you've heard tonight, bringing their practice to the advice to us, and through Cara Prenti's office, and through the state office, through the recommendations for the Department of Public Health. And we've been looking at the data, and we've been looking primarily at the data of the mitigation strategies that we have seen and been collecting. And that's put us in a position to make a recommendation that we're going to be able to say to the community at this point that we have a target time. Given the $5.5 million that we've spent, given the mitigation strategies, we feel comfortable that when we return after the waiting periods that I believe we need to have in January, we're targeting for our elementary schools, the K-5. We're looking at a phasing in process that we would look at tentatively bringing back our elementary folks on the 19th, and then with an implementation of middle school the following week. With the high school at the end of the first semester, it didn't make sense bringing it back for one or 2 days, that we would phase in our opening. Our goal remains to get students and staff back to school safely. When we do return, I do want to let you know that there will be potential for disruption. If there's community transmission results in classes, cohorts and grades in school needing to be quarantined, they may happen last minute. But what I'm finding out, quite frankly, is that it's the new norm. It's what districts are experiencing when they do go back. And for those parents that want to send their youngsters back, we're going to have to expect those things to happen. I assure you that our decisions will always be supported by the guidance from our medical experts, the state and the local officials, and constantly, because it's evolving, the public health crisis, this feedback could necessitate a change to our plan. I mean, it's just the way of the world. But our plan is to look at our mitigation strategies, making sure they're solid and in place. And with that, we believe that we're going to be on the right pathway to when we come back to bring back folks safely. So what I'm looking at are those 3 dates of the 19th, the 21st, and February 1st, tentatively. We will send something out to the parents this weekend with much more clearer plans, explicit plans about what we're talking about here. And then when we return in January, by the end of that first week, send out the confirmation of the dates that we expect to return. Keeping an eye on the data, keeping an eye on everything as you would expect me to. I am no way want to disappoint folks, but I'm not going to put folks in harm's way. But the research, someone opened up the conversation at the beginning, has changed. I think it behooves us to look at that research, to utilize it, and to build upon it. And I think we have the resources now to do that. And I believe that with those resources, we have a wonderful opportunity to come back safely. But we'll finalize those plans that week. But we will be talking to parents by the end of this week, explicitly telling them and talking about our plans to reopen. The board has been very mindful of the work. They've in many ways have made sure that there's been open communications from the summer, from our plan that we developed, from our development of the money to purchase all of these things. So we are of the same mind. We like to see folks, our youngsters back. We think that's it's a three-legged stool, and that one leg is kind of missing. We're doing much, but we need to have that face-to-face. But without question, we want it to be done safely. And we want to give the opportunity for folks to come back. With that said, we will give folks the opportunity now who decide, you know what, for whatever reasons, we'd rather have our student home. You'll have a window to do that. We need time to make the change. You'll have time to make the change so that parents can be all comfortable with their decision in terms of, you know what, at this point, we're going to sit it out and do the DL, which I think you heard is a quality program. So I thank everybody, and I thank the community for your patience. You know, there are things our kids are learning that we would never put forth had we not had this pandemic. Our kids have been very resilient to that. But I know, and you know, hearts of hearts, it's important for our youngsters to be back, and that's our goal. At this point, being a goal is exactly that. It'll be done and finalized with a recommendation that we will discuss with parents in January, but we have a solid pathway back at this point. So Kevin and Ann, I appreciate all that you've done. There are questions, more questions, I think we should put on the website. I want to thank the community this year for their support and for their pushing and for their challenges, because it caused us to think, if nobody's questioning, then everybody's not thinking. So I do appreciate that very much. And it does mold what we do. And we do care about those ideas and things that you put forth to us. So with that, I'd like to turn it back over to Kevin and Ann. Thank you very much.
Dr. Sal, thank you. Thank you so much, sir. So I just want to say to everyone, say to the community, we will have the questions and answers posted to the website. And so I know there was a lot of community feedback and questions. And so the team has taken the time to respond to those questions. Also, Dr. Sal had mentioned there will be a letter pushed out to the community by week's end, and that letter will also be available on the website as well. So I just want to thank everyone for their time this evening and participating in this meeting. Chairperson Cooper, I want to thank you again for encouraging this meeting. And to the Board of Ed, as always, we want to thank you for your participation and ongoing support. We could not do this without you.
Great, and so I'll finish up with our final comments. Thank you, families. Thank you for the Danbury community. We are one community, all working to get our students back in school in a safe, mannerly way. And we wish all of you a happy, healthy, safe holiday season. Thank you for attending tonight and look forward to the information being up on the website over the next few days. Thank you, families. Good night.
Thank you.
Thank you, Anne. Great job.
Thank you.
Great job, Dr. Sal.
Thank you.
Thanks, Dr. Fong.
Yeah, you're welcome. Thank you. You have a wonderful holiday too.
Thanks, you too, sir.
Thank you to all our panels members that work so hard.
Yes. Thank you, Jade.
Thank you, everybody.
Isaiah, Citywide PTO.
Job well done. Good night.
Thank you. Have a good evening, sir.
Yeah, good night.
Thank you, principals.